As a cardiologist, too often I see patients after that disease have damaged the blood vessels in their heart and their body completely. Millions have the disease for years and don't even know it. Now, what are the early symptoms many people ignore with diabetes? Frequent urination, excessive thirst. You're thirsty all the time. You want to drink more water. And often people drink even more sugar, sugary drinks. Fatigue, blurred vision, increased hunger. Some people also experience slow wound healing, tingling in hands and feet. Okay? However, many patients have no symptoms at all in the early stages of prediabetes and even type 2 diabetes. How do doctors diagnose diabetes? Doctors diagnose diabetes with blood tests. First, fasting blood sugar or fasting blood glucose. Second, you can do a glucose tolerance testing. Third, you can do hemoglobin A1C, which reflect average blood sugar over the last 3 months. Hemoglobin A1C, however, can be tricky because 30 to 50% of patients with diabetes may have a normal hemoglobin A1C. Therefore, you need often more than one of those tests to confirm a diagnosis of diabetes. Now, if you confirm with your doctor a diagnosis of diabetes, what are the treatments? How do we treat diabetes? Treatment depends on the type and severity of diabetes where you start, but all types of diabetes need lifestyle intervention. That includes improved nutrition, regular exercise, weight management. Okay? All of that are very important. Second, medications. Nowadays, we have very good medication for diabetes. One of the cornerstones of diabetes treatment, especially in prediabetes and type 2 diabetes, remain metformin because this medication has very good cardiovascular protection and is still cheap. But we also have very good new medication. For example, glucagon-like peptide 1 receptor agonists. I won't name them now, but in the future we'll talk more about them in details. We also have the sodium glucose cotransporter 2 inhibitors. We call those SGL2 inhibitors. Those are very good medications that also have cardioprotective mechanisms. We also have the good old insulin, different forms of insulin, especially for type 1 diabetes and even for some type 2 diabetes, late stage or hard to control. So insulin is still remain a very important part of treatment of diabetes. What are the complications people feel the most with diabetes? Heart disease. The leading cause of death among people with diabetes is heart disease. Kidney failure. Diabetes damages the kidneys filtering system, leading to end-stage renal failure and dialysis. Nerve damage, often causing pain and numbness in the feet, non-healing wounds. Okay. Vision loss due to diabetic retinopathy. Sexual impotence due to pudendal artery and nerve damage. Stroke, okay, due to atherosclerosis deposit in the carotid artery and also in the vessels in the brain. Even dementia, okay? Those are the complications of diabetes, even well-controlled diabetes, okay? So how could you prevent such a hard, terrible disease? Can you actually prevent diabetes? The good news is that prediabetes and in some cases type 2 diabetes can be prevented or at least delayed. The most powerful strategies include maintaining a healthy body weight, exercising regularly, eating whole unprocessed food, limiting sugary beverages, prioritizing sleep and decrease stress, control stress. So even small lifestyle changes can significantly improve your metabolic health and probably prevent or at least delay diabetes. So as a cardiologist, I want you to listen to this carefully. Diabetes is not simply blood sugar disease, it is a heart and blood vessel disease. High glucose damages the inner lining of arteries, causing inflammation and accelerating atherosclerosis, which is plaque formation causing multi-organ damages. That is why controlling diabetes helps prevent dementia, strokes, blindness, heart attack, renal failure requiring dialysis, limb loss, sexual impotence, and many complications. So prediabetes and diabetes may begin silently, but they do not have to control your future. Early awareness, prevention, and treatment can protect your metabolism and your heart. So subscribe to this channel for more videos like this to protect your heart and your health. If you want to learn more about this and other diseases, click on the link you see now on your screen.